Hello, my friends. Today, we need to have a very serious, direct conversation about a topic that scares so many of you, but ignoring it is the biggest mistake you could ever make. We are talking about healthcare, aging, and your money. Specifically, how Medicare pays for skilled nursing facility care, and exactly what you must expect. Let me tell you right now, there is a massive misconception out there. So many of you think, Susie, I have Medicare. If I get sick, if I fall, if I need rehab after a major surgery, Medicare will just take care of it. Listen to me. No, they won't. Not blindly, and absolutely not forever. If you do not understand the rules of this game, you are going to get hit with a financial brick wall that can drain your hard-earned retirement savings faster than you can blink. I want you to wake up, pay attention, and write down what I am about to tell you, because this is about protecting your independence and your wallet. Let's start with the problem and the fear. The fear is real. You or a loved one is in the hospital. Maybe it's a stroke, maybe it's a broken hip. The acute crisis is over, but you aren't ready to go home yet. You can't walk, you can't feed yourself, you need intensive physical therapy or daily medical care. You need a skilled nursing facility. This is not a standard nursing home where people live long-term. This is a medical facility for rehabilitation. The fear kicks in because these places cost thousands upon thousands of dollars a month out of pocket if you don't have coverage. You worry, will I lose my house? Will my spouse be left penniless just so I can learn to walk again? So, here is the big question you need to ask: what does Medicare actually cover, and what are the traps that will leave you holding the bill? To unlock Medicare's help for a skilled nursing facility under Medicare Part A, you must meet very strict, unforgiving criteria. If you miss even one, Medicare will look at you and say, denied. The very first trap, and it is a brutal one, is the 3-day inpatient hospital rule. Medicare requires you to have a qualifying inpatient hospital stay of at least 3 consecutive days before you enter the skilled nursing facility. And listen to me closely, the day you are discharged does not count toward those 3 days. Now, let's assume you met the 3-day rule. You are a true inpatient, and you are transferred to a Medicare-certified skilled nursing facility within 30 days of leaving the hospital for the same condition. How does the money work? This is where you need to understand your benefit period. Medicare measures your care in benefit periods, and for skilled nursing, you have a maximum of 100 days of coverage per benefit period. But do not think those 100 days are free. Let's break down the exact costs. For days 1 through 20, Medicare pays everything. Your copay is $0. That sounds wonderful, right? But what happens on day 21? From day 21 through day 100, you are responsible for a daily coinsurance copayment. This copay increases almost every single year, and it is a hefty amount daily. If you have a Medigap policy, a Medicare supplement insurance policy, or a Medicare Advantage plan, that daily copay might be covered. But if you only have traditional Medicare and no supplement, you are paying that out of your own pocket every single day for 80 days. Do the math. That is thousands of dollars. There is another massive misunderstanding I have to correct right now. Many people think they are guaranteed all 100 days. You are not. Medicare will only pay for those days if you continue to meet the definition of needing daily skilled care. This means you need a registered nurse or a licensed therapist every single day to provide care that can only be safely done by a professional. The minute the facility decides that you have plateaued, meaning you are no longer showing measurable improvement, or your care has shifted from skilled therapy to custodial care like help with bathing, dressing, or eating, Medicare stops paying. They will issue you a cutoff notice, and your coverage ends, even if you are only on day 30 or day 40. Do not let the facility bully you into thinking that just because you aren't improving, Medicare won't pay. There was a landmark court case that clarified the law. Medicare must cover skilled care if it is necessary to maintain your current condition or to prevent or slow you from getting worse. It is called maintenance care. If the facility tries to discharge you or stop billing Medicare because you aren't improving, you have the right to appeal immediately. There will be a phone number on the fast-track non-coverage notice they hand you. Call it. Appeal it. Stand up for your rights. So, what is your actionable takeaway from all of this? How do you protect your retirement nest egg from being wiped out by a medical crisis? First, look at your current insurance. If you have original Medicare, you must have a Medigap policy that covers the part of skilled nursing facility coinsurance. If you don't, you are exposed to massive financial risk. If you have a Medicare Advantage plan, read your evidence of coverage today. Know what your plan charges for skilled nursing stays, because many Advantage plans waive the 3-day hospital stay rule, but they might charge different copays from day one. Second, create a medical advocacy plan. When a crisis hits, you are emotional. You cannot think straight. Designate a trusted family member, a child, a sibling, a friend, to be your healthcare proxy. Give them copies of your insurance cards and teach them about the observation status trap. They need to be your voice in the hospital room, ensuring the paperwork says inpatient so your benefits are protected. Third, understand that Medicare is never, ever going to pay for long-term, permanent nursing home care. If you need to live in a facility permanently because you can no longer care for yourself, Medicare is out of the picture. That requires long-term care insurance, paying out of your own pocket, or completely depleting your assets down to poverty levels to qualify for Medicaid. My friends, knowledge is power. Money itself is powerless unless you know how to manage it, protect it, and keep it from slipping through your fingers due to a lack of information. Do not wait for a medical emergency to figure out how Medicare works. Understand the rules today, check your supplemental coverage tomorrow, and make sure you are fully protected. Stay safe, stay strong, and protect your wealth.